GLP-1 receptor agonists have become widely used for type 2 diabetes and weight loss, but their safety profile is now under intense scrutiny. While these drugs offer cardiometabolic benefits, clinicians and patients must carefully weigh their efficacy against potential risks. Gastrointestinal side effects, such as nausea and vomiting, are common and often lead to discontinuation. Additionally, concerns about thyroid cancer and retinopathy have emerged, prompting ongoing research. Individualized treatment is crucial, as responses and risks vary across populations. In this video, we'll explore the nuanced risks, benefits, and evidence behind GLP-1 drugs, helping you understand what's real and what's speculation. GLP-1 receptor agonists are not just for glycemic control, they're increasingly recognized for their broader cardiometabolic benefits. Obesity is now seen as a chronic disease, and GLP-1 drugs help manage weight and improve cardiovascular risk profiles. Their therapeutic role extends beyond blood sugar regulation, with evidence showing positive effects on heart health and metabolic outcomes. These drugs mimic peripheral GLP-1 activity, but their weight reduction effects are largely due to reduced energy intake, mediated through central nervous system pathways. As their use expands, understanding their full impact on cardiometabolic health is essential. GLP-1 receptor agonists exert anti-inflammatory effects across multiple organ systems, including the lungs, cardiovascular system, liver, intestine, kidneys, joints, and central nervous system. Both preclinical and clinical evidence support these effects, particularly in the cardiovascular system, liver, kidneys, and joints. Neuroprotective mechanisms include reduced protein aggregation, enhanced autophagy, improved mitochondrial function, suppression of neuroinflammation, and preservation of synaptic integrity. Epidemiologic analyses suggest a reduced incidence of dementia, Parkinson's disease, and multiple sclerosis among long-term users. However, anti-inflammatory effects in the central nervous system, lungs, and intestine remain incompletely defined and require further study. Systematic review of 39 randomized controlled trials revealed that GLP-1 drugs increase the risk for nausea, vomiting, diarrhea, and constipation compared to placebo, especially in individuals without diabetes. Gastrointestinal adverse events frequently lead to treatment discontinuation in both clinical trials and real-world settings. Nausea is the most common reason for stopping therapy, followed by vomiting and diarrhea. Slower and more flexible dose titration improves adherence and reduces adverse events without compromising efficacy. However, optimal titration strategies require further study to maximize tolerability and minimize side effects. Most studies on GLP-1 drugs assess gastrointestinal symptoms through self-reporting by participants. While practical, this approach has limitations, such as subjective bias and inconsistent reporting. Future research should incorporate validated tools to assess upper gastrointestinal symptom severity, ensuring more reliable and objective data. Accurate assessment is vital for understanding the true impact of GLP-1 drugs on digestive health and for guiding clinical decisions regarding their use. GLP-1 drugs significantly affect gastrointestinal motility. Studies show that 56% of individuals receiving GLP-1 drugs experience retained gastric content, compared to 19% of those not on these agents. This can lead to premature discontinuation of endoscopic procedures, but no increased risk for aspiration pneumonia has been identified. These findings highlight a clear association between GLP-1 therapy and gastric retention, prompting consideration of whether therapy should be modified or withheld before procedures with aspiration risk. Current guidance recommends individualized approaches. Gastrointestinal adverse events associated with GLP-1 drugs reflect altered GI function. GLP-1 receptor activation slows gastric emptying and suppresses small intestinal motility. Additionally, direct interaction with receptors in brainstem regions, such as the area postrema and nucleus of the solitary tract, may contribute to nausea through activation of the chemosensitive zone. Understanding these mechanisms helps clinicians anticipate and manage side effects, improving patient outcomes. Systematic review of 55 double-blind randomized controlled trials showed that GLP-1 drugs are associated with an increased risk for cholelithiasis gallstones compared to placebo, but not for cholecystitis, cholangitis, or pancreatitis. Early concerns linking GLP-1 drugs to acute pancreatitis were influenced by diagnostic criteria and reporting bias. Robust pharmacovigilance research is needed to evaluate suspected adverse events and clarify the true risks associated with newer therapies. Increased risk for medullary thyroid carcinoma with GLP-1 drugs has been hypothesized in susceptible individuals, but large analyses of clinical trials and post-marketing data found no association in otherwise healthy populations. However, a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2 remains a contraindication to GLP-1 therapy. Ongoing surveillance continues to monitor for potential risks. Subcutaneous semaglutide was associated with more retinopathy complications in the SUSTAIN-6 trial, possibly due to larger reductions in plasma glucose and A1C. Non-arteritic anterior ischemic optic neuropathy, a sudden cause of vision loss, occurs mainly in individuals with T2D. Retrospective data suggest links with GLP-1 drugs, but causality is not established. A meta-analysis found no association between GLP-1 use and risk for optic nerve or vision-related events, highlighting the need for ongoing research. Systematic review of 80 randomized clinical trials found no association between GLP-1 drug use and major depression, suicide, or psychosis. In fact, treatment with GLP-1 drugs was associated with better mental health-related quality of life. This finding provides reassurance for patients concerned about psychiatric side effects, though ongoing monitoring remains important. Meta-analysis of 5 studies in younger individuals with type 2 diabetes showed higher adverse event rates with GLP-1 drugs but low discontinuation rates. This suggests that while side effects may be more frequent, younger patients are more likely to tolerate therapy. Individualized risk assessment remains key to optimizing outcomes. Animal studies show that GLP-1 drug exposure during pregnancy is associated with reduced fetal growth, delayed skeletal ossification, and lower maternal weight gain and food intake. Use is not recommended during pregnancy or when planning pregnancy due to potential risks. Clinicians should counsel women of childbearing age about these concerns and consider alternative therapies. Gastrointestinal adverse effects are more common in people with severe renal impairment. Use of GLP-1 drugs should be individualized after weighing risks and benefits. Clinicians must monitor renal function and adjust therapy as needed to minimize complications and optimize safety. Discontinuation rates of GLP-1 drugs are high among older adults. After 24 months, 68.2% of individuals younger than 65 years discontinued therapy, rising to 75.3% in those aged 65-74 years, and 82.6% in those aged 75 years or older. Reasons include cost, variable efficacy, patient preference, and adverse gastrointestinal effect. Bone loss has been reported with semaglutide, although exercise may reduce this risk. Balancing these risks against cardiovascular benefits is essential in older populations. Weight loss with GLP-1 drugs includes loss of lean body mass, raising concern for sarcopenia. Evidence linking this to reduced physical function remains limited, but caution is warranted in high-risk groups, including older adults and those with low physical activity, low protein intake, or rapid weight loss. Clinicians should monitor muscle mass and encourage resistance training to mitigate risks. Recent research suggests that genetic variants can influence side effects and weight loss outcomes in patients taking GLP-1 drugs. The GLP-1 receptor variant Rs10305420 was associated with slightly greater BMI reduction, while another variant, Rs1800437, was linked to drug-related nausea and vomiting. However, the effects are modest, and non-genetic factors like sex, age, and drug type remain important predictors. These findings lay the foundation for precision medicine approaches but are not yet sufficient for routine clinical use. GLP-1 drugs can affect women's sexual and pelvic health in nuanced ways. Some women report increased confidence, while others experience reduced libido, vulvar skin changes, and discomfort during sex due to fat loss in the labia majora. Vaginal dryness and constipation are also common, which can increase the risk for urinary incontinence and pelvic organ prolapse. Clinicians should address sexual health concerns proactively and recommend pelvic floor therapy when needed. Pelvic floor health is closely linked to overall strength and physical activity. Rapid weight loss without proper support can lead to muscle weakness, impacting arousal and pelvic control. Constipation worsened by GLP-1 drugs can amplify pelvic floor dysfunction. Resistance training and pelvic floor therapy are recommended to maintain muscle strength and reduce symptoms. Menopausal women may be at higher risk for pelvic issues, making exercise and screening essential. GLP-1 drugs change how the body processes fats, which may affect sex hormones. Lower testosterone levels have been observed in women with PCOS or obesity, but research is lacking for other groups. Fat loss in the labia majora can alter vulvar appearance, sometimes dubbed Ozempic vulva. Societal standards and stigmas around labial appearance can impact self-esteem and drive cosmetic procedures. Clinicians should educate patients about normal variation and offer support for hormonal imbalances. While GLP-1 drugs offer many benefits, including improved cardiac status and exercise tolerance, their risks, especially for sexual, pelvic, and metabolic health, must be carefully balanced. Ongoing research is needed to clarify their effects and guide clinical practice. For now, individualized treatment, proactive screening, and patient education remain the best strategies to maximize benefits and minimize harm.